Tonight, Governor Mike DeWine announced $5 million in funding to improve maternal and infant health statewide.
That money will go to 19 organizations to improve support for pregnant women and new parents. But new at 11, 10 TV's Carly Dion attended a panel in Franklin County that says infant mortality in the Black community is as bad as it's ever been.
Last year had the highest racial disparity among infant deaths in recent years, and tonight the panelists shared this year is already on track to pass that number.
Why are Black babies dying more than their white counterparts?
I had goosebumps. I was shaking. I got really emotional.
Mount Carmel maternity nurse Jatu Boykai is talking about her reaction hearing the data on infant mortality rates. Last year, while 1/3 of babies born in Franklin County were Black, more than half of the infant deaths in the county were Black.
You think about each number, you think about each family, you think about the loss.
Franklin County Coroner Dr. Nate Overmeyer, who moderated the panel, says they see 3 times more Black babies that die under the age of 1 than white babies. The data sparking an important conversation to influence change.
We know where the data is. How do we get more community members involved, engaged, and to solve this issue?
The conversation began with each panelist sharing their personal stories as mothers of their childbirth complications, stressing the importance of finding a healthcare provider who understands the pregnancy risks Black women face.
Finding a provider that understands you, that is going to be there for you, that is going to advocate for you, that's going to listen to you, hear you, see you, understand you, that is so important.
The panel also addressed the racism that exists within the healthcare system, saying it's time to stop skirting around the issue.
Don't be ashamed of to talk about racism in healthcare because it is a thing.
And despite the technological advances being made in healthcare every day, not enough is being done to address the issue of disparity.
And with all of those technological advances and innovations, why are people still dying? And why are the numbers going up instead of going down?
Each sector of the community working to take a closer look at how this data can be used to stop this downward trend from continuing.
That we're using the data that we collect in the coroner's office to say, okay, this zip code is really struggling with infant mortality. So how do we get more resources to that particular zip code, that particular community that's dealing with this issue?
Tonight's meeting ended with a call to action for the community to be vocal about legislation and who they elect to office. In Linden, Carly Dion, 10 TV News.